All right, if you've ever taken sleeping pills and you just got a sneak peek, not a good thing. And 3 in 10 women use them a few nights a week. You probably saw a pretty scary study out about them. Here to put it all in perspective is Dr. Joseph Ogile. He's CEO of the Clayton Sleep Institute. You know what? I've taken some of these things before. It is really scary. So people who took sleeping pills were 3.5 times more likely to die prematurely. And this was even people who just took what they thought were a few here and there. This wasn't like they were on them for months and months. What's going on here?
So the not a good thing on this is to caution folks that this is an observational study looking back retrospectively. So the scientific strength of the study is limited. It's one that's an observation. We want to make sure that people in the public and that our patients are not fearful. This is not evidence that sleeping pills used correctly under a doctor's advice are dangerous. That's not what the study shows. So we want to be cautionary about this. This is a study that, and the authors stated this in their conclusions, and I'm sure you were looking at that, which was, this is a study that just raises an issue that we should have some more conversation and study. Part of the problem with what we call observational studies, so for your viewers, observational studies are studies that look back at large populations of patients and just see what was going on. But they're not studies that, for us, when we look at studies when we prescribe medications to decide, for instance, if the FDA is going to approve a drug, they make studies go not observationally and not backward. They make the studies go prospectively or forward. And so in this case, the study's not done in a way that gives it the power for us to change therapy. So if drugs are, the hypnotic drugs or the sleeping pills are being used under a doctor's guidance for the correct reasons, I would say that have faith in your doctor, faith in the fact that these medicines are safe when used correctly, and to look for side effects that any medication could have.
Okay, great advice. I know you probably saw the New York Times article where it called sleeping pills the new mother's little helper. I mean, women have trouble sleeping for so many reasons. So should they talk with their doctor again, not take them as much? What do you think?
Yeah, the sleep problems, and especially in moms and ladies as they enter the years of change, of menopause and so forth, it's an epidemic problem in our country, and it's becoming a problem it has more gravity to it. People are more interested. They see the negative impacts of lack of sleep or poor quality sleep on their life. The answer, of course, is yes, they should talk to their doctor. There are ways to treat lack of sleep with behaviors, with structures we give to their sleep environment, but sleeping medications do have a role when used correctly, and doctors frequently do and mostly use them correctly. So conversations with your doctor is a very helpful and important thing.
Wonderful. Dr. Joseph Ogile, CEO of the Clayton Sleep Institute, thank you as always for joining us.
Thank you, Kay, for your interest.
Great information.
Appreciate it.